and welcome to Picture This, a podcast from the photo archives of the Albuquerque Museum. My name is Jill Hartke, and I'm the Digital Archivist here at the museum. The COVID-19 pandemic introduced new generations to the ways in which the public health sector attempts to isolate and contain a disease. Current policies and practices have roots in the efforts of medical workers in earlier outbreaks of disease. In the early 20th century, people were traveling to the southwestern United States in hopes of finding cures for their illnesses. In the photo archives of the Albuquerque Museum is a photograph showing a young girl with a puppy sitting on the front stoop of her house in 1918. A quarantine sign is displayed beside the front door. Here's the story behind the photograph. New Mexico was a young state when the Spanish flu began to make headlines in 1917. New Mexico may have seemed like a well-prepared state when it came to healthcare because of its marketing campaign to lure sick people to the area and be cured of their ailments. In reality, the economic benefits of wealthy Easterners traveling to New Mexico in search of fresh air and sunshine outweighed the more practical side of healthcare, such as providing care to locals, educating communities on hygiene, and recording births and deaths. To live in Albuquerque in the 1910s meant living in a place where people paid top dollar for healthcare and sanatoriums, but were mostly left to their own devices in the neighborhoods. There was no state health department, New Mexico being the only state in the Union without one, as the reach of the Spanish flu began to extend across the country. When influenza arrived in Albuquerque in the fall of 1918, doctors didn't really know what they were dealing with. They knew it was coming, but the medical community at the time believed the flu to be a bacterial disease rather than a virus. There were flu vaccines available, but the trust in a vaccine against the flu in Albuquerque seems to have been relatively low, and for good reason. The vaccines were experimental at best. Still, some people did get vaccinated during the years of 1917 to 1919. Maybe it helped. Some people avoid the bacterial pneumonia associated with the flu, or maybe it didn't help at all. The flu hit areas of the state incredibly hard, especially northern New Mexico and several of the pueblos. Without a state health department, the response was left to the individual local governments, who all reacted in different ways. In Taos, you had to wear a mask when you went outside your home. On the Navajo Nation, when a person died, the hogan was burned, and the family of the deceased went to live with other relatives, spreading the flu throughout the community. In Albuquerque, restrictions on businesses and a public ban on gatherings were put in place. The city never required masks to be worn, but it did put quarantine signs on houses of families who were suffering from the flu. The problem was that many families did not adhere to the quarantine guidelines, and they often tore down the sign on their homes alerting others to the danger of illness. The lack of health education led people to believe the flu was less contagious than more fearsome diseases like scarlet fever, typhoid fever, or tuberculosis. Tuberculosis was by far the major contagious disease in Albuquerque in the early 20th century. The large sanatoriums in Albuquerque were there to quarantine patients and treat the illness with sun therapy, fresh air, regimented diets, and specific exercise routines. Sanatoriums mainly served patients who could afford to pay the high costs of specialized care, uproot themselves from their work and their loved ones, and spend an unknown length of time in quarantine. Doctors had no cure, often no vaccine, and no antibiotics. The plan was to slow the spread of disease by containing it through the isolation of patients from the outside population. Despite the effort and money put into treatment, tuberculosis often proved deadly. Recently, historians are theorizing that the death toll attributed to the Spanish flu of 1917 to 1919 is not due to influenza alone, but rather a combination of young adults who contracted the flu when they already had tuberculosis. In New Mexico, because doctors and nurses did not believe the flu was a respiratory virus, and because there was no state health system with hospitals and clinics, soldiers who contracted the Spanish flu at places like Camp Cody near Deming or the Armory in Santa Fe were moved into sanatoriums alongside the tuberculosis patients. This provided a field day for the epidemic to rage among the already quarantined and convalescing population. Anywhere between 1,000 to 5,000 deaths in New Mexico are attributed to the Spanish flu, but many thousands more died of tuberculosis. It isn't a surprise that TB was the leading cause of death in New Mexico until the 1940s, when so many people sick with the illness were flocking to the state. But many Americans had dormant tuberculosis, and when the flu arrived, it swiftly claimed the lives of 150,000, mostly people in their 20s and 30s. In Albuquerque, 167 people died of the flu during the epidemic, which seems like a low toll considering its relative population density, although if you add in the deaths attributed to tuberculosis during that same time, the story might look quite different. More people around the world died of tuberculosis in 1918 than any other year in the 20th century. The loss of life and the disorganized response led to one of the lasting effects of the Spanish flu in New Mexico, the creation of the State Health Department in 1919. The newly created department had a lot more than tuberculosis or the flu to worry about. In many homes, the specter of scarlet fever, typhoid fever, and diphtheria was terrifying. The flu was generally considered a danger to older people. Tuberculosis was a danger to adults in their 20s or 30s, but scarlet fever killed children. Large outbreaks of scarlet fever were common in the 19th century. Highly contagious and deadly, it could kill within 48 hours of the onset of a sore throat and a fever, and it was especially deadly to children aged 5 to 15. The disease spread like most infectious diseases from people socializing and infecting one another. But in many of these outbreaks, the bacteria that caused scarlet fever was found in milk. Pasteurization or sterilization of milk was not common in the United States until the 1920s. Frank Castator was a pharmacist who lived and worked in Albuquerque in 1918. In the heart of health country, with the Spanish flu looming and tuberculosis raging, Frank's 13-year-old daughter Nelda contracted scarlet fever. The isolation period for scarlet fever was around 6 weeks of quarantine, and Frank followed the protocols necessary for his daughter to isolate from the world at their home on South Edith Boulevard. Scarlet fever could develop quickly, and the patient was not safe to return to their normal routines of school or work until the fever subsided, the skin finished peeling, and the tongue stopped swelling. The Castator home had a quarantine notice glued to it, alerting visitors and neighbors that scarlet fever was present and that the house and the Castator family was under quarantine. The practice of adhering signs to the homes of families afflicted with contagious illness was common, and delivery workers were routinely warned against delivering milk, picking up laundry, or otherwise providing any service to a quarantined home. In 1918, Albuquerque leaders went so far as to threaten arrest and prosecution to the highest degree of any delivery driver seen delivering to a house under quarantine. For Nelda Castator, quarantine seems to have been relatively uneventful. She did not develop a severe case of scarlet fever, and she noted on the back of her photograph that she suffered a headache for just one day of the whole 6 weeks she was isolated at home. Others were not so lucky. Scarlet fever ebbed and flowed over the years, and the newspapers routinely listed families tending to children with scarlet fever or grieving the loss of a child from the disease. In 1924, 6 years after Nelda's bout of illness, scarlet fever was widespread, covering many neighborhoods in Albuquerque, and the State Health Department tracked the disease on a map in their office. Public education campaigns on health protocols were everywhere. Health workers routinely published pleas in the newspaper for parents to keep their children out of school if symptoms of scarlet fever appeared. In the 1940s, antibiotics and stricter health protocols seems to have helped to subdue scarlet fever to more of a seasonal childhood illness. It became more akin to a rash alongside a sore throat, and the fear of the illness diminished. Although the disease has been making a strange comeback since 2014 in a much less deadly form. Its resurgence is baffling to scientists and health departments who are reviving public health education campaigns for a disease many had considered conquered. New Mexico's early years as a self-asserted haven of healthcare was in stark contrast to the reality of the state's lack of preparedness for a local healthcare crisis. Still, the efforts to remedy that and work toward a healthier population began in large part because of that lack of preparedness for the influenza epidemic of 1918. At the time of this recording, New Mexico is in the midst of fighting COVID-19 and is undergoing a massive vaccination and public health education campaign. The efforts of healthcare workers who saw New Mexicans through epidemics of the past and those early years of the Public Health Department form the bedrock of the efforts we see and are living through today. Thank you for joining us for Picture This with the Albuquerque Museum. Please join us next time as we hear the story behind another photograph in the museum's collection.